Namaste, everybody in the United States, in India, and all over the world. And welcome to this webinar hosted by the American Academy of Yoga and Meditation. My name is Akash, and I will be your host today. The American Academy of Yoga and Meditation is a nonprofit organization dedicated to promoting and spreading the philosophies of yoga and meditation derived from the ancient yogic texts. Through this month-long webinar series, we hope to inform as many people as possible about the unparalleled benefits that yoga has across the board of different aspects of medicine. Today, we will hear from renowned speakers about how yoga and meditation can help in the prevention and treatment for patients with cardiovascular diseases. Cardiovascular diseases are the #1 cause of death in the world, with approximately 18 million deaths per year worldwide. A major cause of cardiovascular diseases is a bad lifestyle. Many people eat unhealthy food, don't do any exercise, smoke cigarettes, and have a lot of stress in their daily life. Because of this, they get illnesses such as hypertension, diabetes, obesity, and other things like that. Yoga and meditation have been proven to alleviate these risk factors significantly. Over the past couple of weeks, AAYM has broadcasted a series of webinars in which we have discussed the great benefits of yoga in relation to topics such as obesity, diabetes, and even hypertension. And today, we will learn how all of this culminates to alleviate the major risk factors that indicate cardiovascular diseases in our webinar today, Yoga and Cardiovascular Diseases. It is now my honor to inform you that we will have the opportunity to listen to some very important speakers today. Our first speaker today is Dr. Subhash Manchanda, a cardiologist and the senior consultant for the Sir Gangaram Hospital in New Delhi. He is also the recipient of the Padma Shri Award, which is one of the highest civilian honors in India. Our next speaker today is Dr. Prabhakaran Durairaj, who is the Vice President of Research and Policy at the Public Health Foundation in India. And he is also the Executive Director of the Center for Chronic Disease Control. Our last speaker today is Dr. Indranil Basure. Dr. Basure is a cardiologist and cardiac electrophysiologist and is also an adjunct professor at the University of Memphis in Tennessee, United States. He is also the founder and chairman of AAYM, the organization that is bringing this webinar series to you today. Now, I would like to take the opportunity to introduce our moderator for this session today, Dr. Nirmal Gupta. Dr. Nirmal Gupta is a professor and the head of cardiovascular thoracic surgery at Sanjay Gandhi Postgraduate Institute of Medical Science in Lucknow, India. He has an experience of 38 years in cardiovascular and thoracic surgery. He has an experience of 43 years in medical curricular and clinical teaching. He is the founding chairman of Bless a Heart Mission and the founding president of Arogya Bharti SPGPI unit. He is also the vice chairman of AAYM. Thank you so much for coming once again, and I will now hand it over to Dr. Gupta to introduce the speakers. Namaste.
Thank you, Akash. Thank you, Akash. Namaste. Good evening, good afternoon, and good morning to all the viewers, depending on the time zones you may be joining us for this webinar. I am honored and privileged and would like to convey my most humble gratitude for the opportunity to be the moderator of this session, which has a galaxy of eminent medical researchers and physicians from both ends of the globe. Allow me to set the stage for our honorable panelists. Cardiovascular disease, as you have been told, is indeed a prime global health burden that comes with a harrowing statistics in the term of disability-adjusted life year loss due to associated morbidity and immense pain, and suffering to more than 20 million families every year worldwide. Nevertheless, it is thought that the risk of CVD can be lowered by changing a number of risk factors, such as by increasing physical activity, using relaxation to reduce stress, both are which part of the yoga. I humbly request all the esteemed panelists to be aware of the time constraints, that is 75 minutes for this discussion. And before I invite our first speaker, a very well-known Honorable Professor Manchanda, to enlighten us all with his views on primary, secondary prevention of CVD in yoga, I would briefly introduce him to your viewers around the world. As you have been told, Professor Manchanda is currently a senior consultant at Gangaram Hospital, New Delhi. He was my senior colleague in All India Institute back in 96-97, but I never had the opportunity to work with him as such because he is in cardiology and I was a cardiac surgeon working with Professor Venugopal. Anyway, Professor Manchanda, please start your presentation.
Slides are visible?
Yes, sir.
Thank you. Thank you, Dr. Gupta, for this nice introduction. And I'm going to talk about primary and secondary prevention of heart disease by yoga lifestyle, a subject which is very close to me. I have been into this research of yoga for the last about 25 years. At that time, very few cardiologists were interested in it. As you heard that cardiovascular disease is the leading cause of death all over the world. At least about 31% of patients who die of any disease die of heart disease. And it is increasing in spite of all the advances that we have made. The deaths are increasing, and also the prevalence of the disease is rapidly increasing, especially in the developing countries. At least 3/4 of the patients who have heart disease are in the so-called developing countries, middle and the lower income countries. And there's a huge economic loss. And we have to think why this disease has really not decreased, because people are more aware, at least even in developing countries, in the urban population, they are more aware what are the risk factors and how to prevent them. Why don't they really follow that? So we should do some introspection and see why lifestyle diseases like heart disease are increasing in spite of improved knowledge. People are aware, earlier they were not aware 25, 30 years earlier what causes heart disease. Now they all know it, that it is the diet, it is the exercise, smoking, and stress. The reason is because lifestyle is not a simple thing. It's a complex phenomena in which lifestyle choices like diet, exercise, smoking, and mind-body interaction, including behavior and stress, are prominent. I think we have done a lot of studies on diet, exercise, smoking, but stress has remained really not, hasn't received enough importance. And the behavior of the individual. Many of my patients, I ask them, why don't they exercise? They say, we want to exercise, but our mind says that don't do it today, do it tomorrow. So I think the behavior of the individual has to be changed. And there is a strong mind-body relationship. We know that these are mind-body problems, stress and behavior. And we know mind-body and mind-heart relationship is very, very strong. Disturbance in the mind cause stress, which may contribute to the causation of lifestyle diseases. The stress is a very, very important factor, and I will show you how it can really contribute to these heart disease and other lifestyle diseases. And therefore, holistic and mind-body techniques like yoga may be useful. This is our ancient yoga philosophy, which shows that human existence has really 5 layers of existence. We all know about this, that physical sheath is called the Annamaya Kosha. We know a lot about this. Then Pranamaya Kosha is the vital sheath, which is the autonomic nervous system and the breathing. And then is the Manomaya Kosha, or the mind, or the astral sheath, surrounded by Vijnanamaya Kosha, or wisdom sheath, and the Anandamaya Kosha, the bliss sheaths. Bliss sheath is really the sign of perfect health. So because there's a disturbance in this manomaya kosha, we have to treat the mind also. And in the modern science, we have not really been paying much attention to the mind. We have been giving attention to the body and the autonomic nervous system. And that's why possibly the disease is not being controlled. And therefore, a modality which can control the mind could be helpful. And we will see how. This is how stress has been shown to contribute to the causation of heart disease and other lifestyle related diseases. We all know that stress stimulates the hypothalamic pituitary adrenal axis, the HPA system in the brain, and that releases several hormones like glucagon, cortisol, renin, vasopressin. Cortisol can cause lots of problems like dyslipidemia. It can cause diabetes. It can change the behavior of the individual. It can increase inflammation, and also immunosuppression can occur. Renin vasopressin can cause hypertension. On the other side, stress increases the sympathetic activity. We all know that, which releases epinephrine, norepinephrine, which can increase heart rate and increase blood viscosity. And in this complex interaction, we can get heart disease, diabetes, even arrhythmias and heart failure. So this is how stress has been shown to be contributing to the causation of this disease. Now, yoga, what is yoga? I know this conference is about yoga and there are very experts, but when I started my research, I wanted to have a very simple definition. This is what I believe, that yoga is a lifestyle. Yoga is not merely a few postures, but a complete way of life. Because many people initially thought about 25 years back that it is a complicated asanas, etc. But it's a complete way of life. Actually, it's the best lifestyle ever devised, as I will show you. It aims at harmonious development of body, mind, leading to physical well-being, mental harmony, culminating into positive thinking, happiness, and peace. And yoga lifestyle consists of physical, mental, emotional, and spiritual well-being. This is what I believe yoga lifestyle is. I call it a lifestyle. It has four components. The physical component is the diet. We know the sattvic diet, how useful it is. Exercise is a part of yoga, and no tobacco and alcohol. That everybody agrees that these are important things. I think the mental part is important in yoga because stress can be managed through meditation. There are a large number of studies to show that. Emotional well-being is a very important part which we have neglected. Control of anger, ego, jealousy, hostility, increase in compassion and love. Actually, we have neglected the role of this emotional imbalances. We know anger can cause cardiac arrest, stress can cause cardiomyopathy, etc. But can it cause atherosclerosis? Actually, there are some experimental studies, very old studies, in which it has been shown that even in animals, you give very low fat diet and produce anger, they can develop atherosclerosis. On the other hand, we don't know the role of compassion, but there is a study in rabbits who were fed high fat diet. They usually develop, all of them develop atherosclerosis. But in one of the experiments, a group of rabbits did not develop in spite of very high cholesterol. And this was because the technician used to take them out, fondle them. So compassion can possibly prevent. I think we have to study more about this emotional effects on the heart. And spiritual, we know that it has extremely useful things for the heart and the whole body itself. Uh, these are the disciplines which have been really discussed by Patanjali: Yam, Niyam, Asana, Pranayam, Pratihar, Dharana, Dhyan, and Samadhi. It basically consists of three parts. That is the stretching exercises or asanas, then is the breathing or the pranayam, and then is the meditation. Now, these are not difficult at all because I had patients who were 70, 80 years, could not sit even on the floor. And we devised a chair yoga that is about 25 years back. And they had equally benefit because everybody can do pranayam and could do meditation and all. And this has to be learned how to breathe properly. So I call yoga as a very simple exercise that sit properly, breathe properly, and think properly. And that's all. These are the three components out of which meditation is one of the very important. So is the breathing, so is the stretching. All the three have been shown to improve the cardiovascular status, but the combination is much better. So meditation is the seventh step of Patanjali's Yoga Sutras, and I think this is an essential part of yoga that must be remembered because sometimes they are separated. So what is yoga then? It is a holistic and intensive lifestyle modification consisting of stress management, healthy diet, regular physical exercise, and avoidance of tobacco. I call it a lifestyle polypill. You must have heard of pharmacological polypill in which put aspirin, statins, and other things, and we think that it can prevent heart disease. But there is no polypill better than this because no pill can manage stress, can have a healthy diet, and have regular exercise. So I think all these four factors cause heart disease. So theoretically, it looks extremely logical that yoga could be helpful. But let us see. We will have the evidence whether it is true or not. Now, yoga, as you know, has been claimed to be beneficial in large number of conditions like anxiety, depression. We had a lot of discussion in this conference itself about all the many of them: mental peace and happiness in bronchial asthma, physical fitness, irritable bowel syndrome, joint pains, cardiovascular diseases, and even cancer. But I'm going to talk about the role of yoga in prevention of cardiovascular disease today. Well, cardiovascular disease can be considered as a continuum. You all know that it starts with some risk factors like dyslipidemia, hypertension, diabetes, smoking, and psychosocial stress. All these are called risk factors for heart disease. They, in a complicated manner, produce oxidative stress, neurohormonal, and inflammation, which ultimately leads to atherosclerosis, which can increase and then causes myocardial ischemia or angina. It can cause coronary thrombosis or rupture of the plaque, myocardial infarction, which can result in arrhythmias and then ultimately heart failure and deaths. Now, yoga has been shown, large number of studies, I will review some of them with you, in controlling most of these factors. And this is in the primary prevention. Psychosocial stress is a very important risk factor. It has been shown for hypertension, diabetes, as well as heart disease. And there is strong evidence that yoga can reduce stress and lead to improvement in both cardiovascular response and recovery from stress. Several randomized studies and meta-analysis suggest yoga is extremely beneficial in controlling anxiety and depression and psychosocial stress. This is very important from cardiac point of view because patients develop depression after myocardial infarction, after heart failure, and the mortality is increased. So, yoga could be extremely useful in those conditions. The mechanism also has been studied that neurotransmitters like serotonin and GABA are decreased, and there's a decreased sympathetic activity also. Now, what about the other risk factor, which is very important risk factor, is hypertension. It has been discussed already, but this is some of the randomized studies which have been shown in this meta-analysis of about 7,000 patients. There are about more than 40 studies, and most of these studies have shown a modest decrease in blood pressure, systolic decreasing by 5 to 10 and diastolic by 3 to 6. So this is a modest decrease, but it is consistently seen. And this is a small study we did some years back in which we showed that ambulatory blood pressure in pre-hypertension can be reduced slightly. The mean arterial pressure reduced, 24-hour systolic blood pressure and morning surge were also reduced. So I think there is a need for more studies with ambulatory blood pressure because we know that during ambulatory blood pressure, patients can develop early morning rise of blood pressure. They can develop nocturnal blood pressure, and so on and so forth. So many of these syndromes are related to autonomic imbalance, and yoga may be helpful. So more studies are needed. Although we found that the reduction in blood pressure was very modest, but as you all know, 2 millimeter decrease in diastolic blood pressure can reduce heart disease and stroke by about 5 and 10%. And because of its effect on hypertension, I think several American Heart Association scientific statements have been made. The first was in 2013, in which they said meditation should be used in all patients who have mild. But this was the second one in 2017, in which Dr. Basure was also a part. And they say overall, it appears that yoga and meditation is useful in controlling the risk factors, although the studies are not very strong, many of them. Methodology is not good, but being a non-invasive, risk-free, without any side effects, this could be used in addition to the usual in the control. And recently, it has come in the guidelines. This is for the first time that guidelines. This is International Society for Hypertension, and they say in their non-pharmacological regular physical exercise, and yoga has been used here because yoga has been used as a regular physical exercise here, which is I don't think very correct. But I think the second part says that reduce stress and induce mindfulness. And here also transcendental meditation has been used. For the first time, they have agreed that chronic stress may be causing hypertension, although more studies are needed now. So it is coming in the modern guidelines also now. What about diabetes mellitus? Another important risk factor. Again, there are at least 24 randomized control studies. These studies are small, of course, and the follow-up is also small. That's why there are limitations in many of these studies. But I think most of these studies have shown a decrease in the HbA1c 0.5 to 1. And also they have shown other improvements in these, that lipids are improved and the obesity is also improved. So the studies, although small, have shown that it could be useful. And this was the largest study of Dr. Nagaratna. I'm sure she has presented in this conference also, that this was the largest study in 3,400 pre-diabetic patients from 29 states, and yoga performed a regular practice for 3 months. And at 3 months, they found that there was a 47% risk in developing diabetes, and normoglycemia was achieved in 52%, much more than about 40% the control. So short-term yoga practice can prevent diabetes. This is a great news, I think, for Indians, because we are the diabetic capital of the world. In obesity also, there are small studies again, and most of the studies have shown that it may reduce the BMI. A large study which was presented in this conference by Dr. Shirley Tallis from Patanjali has also confirmed the same thing, that that's a very large study. These are small studies, and even in metabolic syndrome, it has been shown that it reduces central obesity and several other markers of metabolic syndrome, like blood pressure, lipids, blood sugar, and including salivary cortisol. Even insulin resistance has been shown to improve. What about smoking cessation? Again, there are small studies, but there are several of them, and it has been shown that it may be useful in quitting smoking. We need more studies, but these studies are very small and followed for a short period of time. But I think they could be extremely useful, because one of the studies shows that MRI, that the brain activity in those areas where the mind becomes strong are improved. So it may be useful. What about lipids? This is another important risk factor, and this has been again studied in uh, several investigators. Again, small studies, but most of the studies again show small decrease in LDL, triglycerides, and increase in HDL. So this could be extremely useful in patients. Our studies also showed who are having statins, and this could be used as an adjunct. Even in patients for primary prevention, a small decrease could be. What about reversal of heart disease? This is my interest for quite a period of time. And there are two types of atherosclerosis. We know early atherosclerosis, uh, and that is in metabolic syndrome. We took 100 patients of metabolic syndrome from our OPD. Half of them we randomized to yoga, and the other half by the usual therapy, and followed them for 1 year. We found that at 1 year, on the right side, you see there is a decrease in the carotid intimal medial thickness, which is a surrogate marker of early atherosclerosis. So it seems that early atherosclerosis could be reversed as against the control by yoga. In addition, in our study, we found that the other biomarkers like BMI, the blood pressure, and the blood sugar also was significantly reduced. What about advanced atherosclerosis? This is a study we did long back, inspired by Dean Ornish. Dean Ornish had done 40%. The first study more than 70% and user-friendly program. In this study, we showed there was regression by coronary angiography. This study was by angiography. By regression, we mean more than 10% reduction in the luminal area, and the progression was significantly reduced. We also showed that the revascularization procedures was reduced, indicating that possibly rupture of the plaque decreases. And we postulated at that time that yoga possibly changes the morphology of the plaque, makes unstable into stable plaque. I think more studies are needed in intravascular ultrasound. We also showed that these patients had improved quality of life, the stress markedly reduced, angina also reduced. This has all been published now. And that was the follow-up is very short. What about the clinical endpoints? There are very few studies actually. This is a study from the United States on transcendental meditation, in which patients of heart disease have been followed by transcendental meditation or health education. And see, at the end of 9 years, there is a 48% reduction in the primary endpoints of mortality, non-fatal MI, or non-fatal stroke. So it appears that although it's one study, that on a long-term follow-up, this may be useful. On atrial fibrillation, this has already been discussed. This is Dr. Reddy's study that atrial fibrillation could decrease because of yoga, and quality of life could improve. And also such studies are available in ventricular ectopics and after ICDs also. What about cardiac rehabilitation? This will be discussed, of course, with Dr. Pavakar, who has done an extremely landmark study. But this is an old study of bypass patients of 250. And it showed, this is again from Bangalore, that the LV ejection fraction improved, lipids improved, and glucose improved, and they had better quality of life. This is, I think, the landmark study which Dr. Prabhakar will be discussing. This is yoga-based cardiac rehabilitation after acute myocardial infarction. I think this is a study which has brought attention of all the cardiologists all over the world, and Dr. Prabhakar will be discussing this. What about heart failure? A few controlled trials suggest that 12 weeks practice of yoga improves left ventricular ejection fraction, peak oxygen consumption, and quality of life. In addition, yoga causes weight loss, improved mood, and decreases inflammatory marker. This is a small study we just presented in the Cardiological Society, and we showed that the yoga group, there is an improvement in the ejection fraction much more. The in markers like NT-proBNP decreases much more. The inflammatory marker like CRP also decreases much more, and the quality of life is better. I think more studies are needed in heart failure. It appears very, very promising. This is the mechanism which has been proposed. I will not discuss in detail because Dr. Basure is going to discuss it, but I just like to say that yoga acts through 4 mechanisms. One is through the HPA system, the hypophysis pituitary adrenal axis. The second is the changing the brain structure and function, which we'll discuss. In neuroplasticity, the brain can grow and new things can occur. It's also a mild exercise, and then it can also stimulate vagus, which has tremendous effects. And all these in combination can possibly prevent atherosclerosis, hypertension, etc. And again, Dr. Basu is discussing this, that inflammatory markers are reduced and also improved endothelial function is there. Nitric oxide is also improved. Oxidative stress is also improved, and it may also affect the gene expression and also affect the telomere length. So what are the limitations? These studies, although several studies are there, that yoga is useful in primary and secondary prevention, there are limitations. Most studies are single center, small samples, and they're not randomized, some of them. So follow-up is short, and outcome studies, this is the most important thing. We don't have clinical outcome studies, and this is what is needed. So multiple large randomized studies with uniform methodologies with long-term outcomes are needed. So to conclude, friends, I have tried to show yoga is a holistic mind-body technique. It's actually a lifestyle, the best life ever achieved. Appear extremely promising in primary and secondary prevention of heart disease. Reported studies have several limitations. Large multi-center trials and improved methodology are needed. However, yoga being a simple, cost-effective technique without side effects could be incorporated as a complementary technique for prevention of heart disease. Thank you very much, and I wish you all the best for the International Day of Yoga, which is tomorrow. I'm very glad that this conference is being held on this day. This is the 6th International Day of Yoga. Thank you very much.
Panchanda, for your excellent presentation, where you discussed primary and the secondary prevention of heart diseases. I liked your analogy about the polypill, the lifestyle polypill for yoga. I think you are absolutely correct. In the last 100 years only, that heart diseases have increased so much, and obviously the importance of yoga is now being understood. I'm sure that the way we are going ahead, we will be using yoga and meditation to a large extent all over the world. Now, I would like to introduce our next speaker, that is Professor Prabhakaranji. He will speak on yoga-based cardiac rehabilitation after myocardial infarction. Professor Prabhakaran is an eminent and internationally renowned cardiologist, epidemiologist, and a researcher. He is currently the Vice President of the Research and Policy, Public Health Foundation of India, Executive Director of the Center for Chronic Disease Control, New Delhi, and Professor of Epidemiology at London School of Hygiene and Tropical Medicine. He is also the head of the WHO Collaborating Center for Surveillance, Capacity Building, and Translational Research in Cardiometabolic Diseases in the Southeast Asia region. Professor Prabhakaranji, please, over to you for your presentation. Your mic is muted, sir.
Sorry. Thank you, Dr. Gupta, for that very kind and generous introduction. So let me just share my screen. And, I hope you are able to see my screen.
It is there.
Are you able to see my screen?
Yes, sir.
Oh. Sorry. Okay, I'm sorry for this.
It's all right. It's all right.
Okay, so I'm not going to take, because I contributed to wasting 1 minute, I'll try and finish in 14 minutes. So I'm going to answer 4 questions today. After the 2D force of Professor Manchanda, I thought there's nothing much I should be able to say, but I'm going to try and answer 4 questions. The first is, what is cardiac rehabilitation? Second is, how does yoga or yoga care fit into cardiac rehabilitation? Third is, how did we generate the evidence? And fourth is, where to from here? And I think these 4 questions are important for us to understand. Now, I just want to briefly say what we are doing in yoga. One is, we have created a heart-friendly yoga package. Second is, we have worked to show the demonstration of benefits of yoga in cardiac rehabilitation post-heart attack. And this is the example of a heart attack. Yoga and diabetes, yoga and cessation of tobacco use, and yoga and reversal of atherosclerosis. So the first question that we want to know is, how will cardiac rehabilitation help a post-heart attack or a post-myocardial infarction patient? So for that, we need to know the changes that happen after a myocardial infarction or a heart attack. So within the first year after a heart attack, almost 15 to 20% of patients are likely to get a second heart attack or a heart attack or die of a heart attack within 1 year. The second is, there are increased chance of having irregularities in the heart rhythm, increased risk of sudden death, increased stroke, heart failure, depression, and work-related issues. The suboptimal return to pre-infarct activities, that is, return to activities before the onset of heart attack, reduced motivation to work. There's something called presenteeism, which means that people go to work but they're unable to work to their full capacity, and absenteeism, and there are several others, including problems with sexual activity, personal life, and so on. So all these requires, and I'm not saying that it occurs in all the patients who have had a heart attack, it occurs in a considerable number. All these, if you put together, it would occur in 15 to 20% of the people. And to prevent and help people achieve their full potential, we require what is called as cardiac rehabilitation. Now, we all know what is rehabilitation. The dictionary definition of rehabilitation is the action of restoring someone to health or normal life through training and therapy after incarceration, addiction, or illness. And we are focusing on illness here. So the WHO defines rehabilitation as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. And in that context, cardiac rehabilitation is the process by which persons with cardiovascular disease or heart disease, that includes a variety of heart disease, which Dr. Manchanda so eloquently outlined for us, are restored to and maintained at their optimal physiological, psychological, social, occasional, and emotional status. So you can see there is a wide range of things that can be done with cardiac rehabilitation, and this is the definition given by the American Association of Cardiovascular and Pulmonary Rehabilitation. Like Dr. Manchanda, I also wanted to say what is yoga for me, because the cardiac rehabilitation where we use yoga was predicated on these 4 principles. As you can see, actually 5 principles. As you can see, Dr. Manchanda outlined the various Ashtanga yoga principles, but in our study, we use these 5 principles: niyama, asana, pranayama, pratyahara, and dharana. So it is a complete lifestyle package consisting of right diet, avoidance of tobacco, avoidance of alcohol, stress relief, meditation and mindfulness, various physical postures and physical activity, and the breathing exercises. So what did we show? I'm just giving you the results first, and then I'm going into the details of how we did that. We demonstrated the benefits of yoga in cardiac rehabilitation after a heart attack by showing that it improves quality of life. There is an early return to pre-infarct activity, and there is a potential for reduction in mortality and major adverse cardiovascular event benefit. But we are assessing that in the long-term follow-up. We are continuing the follow-up now. The results will come next year. But I just want to point out, this is the largest yoga trial in the world. Indeed, it is the largest cardiac rehabilitation trial in the world so far. So what are the aims? What were the aims when we started the study? Our aims were to compare the effectiveness of yoga-based cardiac rehabilitation, we called that as yoga care, with enhanced standard care in post-myocardial infarction patients on cardiac morbidity, mortality, and quality of life. And the outcomes which we assess, if you recall, Professor Manchanda said that we require hard clinical outcomes, and that's what we went for. So we looked at what we call as time to occurrence of the first cardiac event, which was a composite of death, non-fatal myocardial infarction, that means survivors of heart attack and stroke, and emergency cardiac admissions. The second co-primary outcome that we looked at was quality of life, based on a very standard tool which has been used worldwide at 12 weeks. The secondary outcomes that we looked was to look at return to pre-infarct daily activities at 12 weeks, using again a very standard tool which is used worldwide. We looked at smoking cessation at 12 weeks, and we looked at compliance to prescribed medications at 12 weeks. So what were the methods that we used? This was a multicentric study. We chose 24 centers in India, and we used what's called a probe design, prospective, random, open, blinded endpoint assessment. Because the study is open, people know in which group they're getting into yoga care as no yoga care, but we wanted the endpoints to be assessed in a blinded fashion. People who assessed the endpoints did not know to which group these patients belong. The total duration of the study was close to 50 months, started in August 14 and ended in September 18. We had a total sample size of close to 4,000 patients, and this had an 80% power to detect 20% reduction in cardiovascular events. We assumed that there will be 20% event rate. That means 20% of the people would have either died or a heart attack, or had a stroke, or would have been hospitalized for a cardiovascular condition within that 30-month median follow-up period. And it had 99% power to detect difference in quality of life. We used what is called as an intention to treat analysis, which is a very rigorous method of analyzing the data, and it's a standard method used by most large studies. We also looked at what we call as per protocol analysis. Here, which means people who followed our advice completely in terms of yoga adherence. The inclusion criteria was that all adults below the age of 18 years were included. They had to have had a heart attack within 14 days of a They had to be included within 14 days of an acute myocardial infarction, and they should have been willing and able to attend the complete cardiac rehabilitation program. The exclusions included patients not likely to complete follow-up, self-reported regular practice of yoga, and participation in other clinical trials and comorbidities that may limit the life expectancy less than 12 months. These are very pretty standard inclusion and exclusion criteria.
Namaste, Dr. Prabhakaran.
Yeah.
You are currently not screen sharing. I'm not sure if you're trying to screen share. Could you please screen share because we do not see your screen?
Right. I don't know. I just once again.
Sorry about that. Could you please try to share screen once again?
I thought it was being shared, but I don't know how it happened. So
that's okay. Technical difficulty.
Can you see my screen now? No. Can you see the screen?
Yes, I think now.
Now it is coming.
Can you please full screen your slides?
Yeah, there are so many windows open. When I close that window, it goes off. Is it visible now?
Yes, please full screen your slides.
Pardon me?
Perfect. Perfect.
No.
Thank you.
I'll just go to the slide. Okay, so I was at this slide and I was talking about how we developed the intervention for the yoga care. So it was done through a structured process. We looked at ancient literature. We consulted with yoga experts, cardiac rehabilitation experts, and even post-heart attack patients to see whether it would be feasible to do it with them. We refined using feedback from an internal stakeholder group and an external panel of international experts, and we piloted this initially with yoga teachers and post-MI patients. The structure of the yoga care sessions were aligned to cardiac rehabilitation. If you recall, cardiac rehabilitation has 14 sessions. So we started with, in the first week, we provided education on lifestyle. In week 3, we provided meditation and breathing exercises, that is in the second session. The week 5 to session, we provided full yoga training session twice per week. These were sessions 3 to 8. And weeks 8 to 13, we again provided full yoga training session once per week. These were sessions 9 to 13. And week 14 plus was self-practice at home. The personnel who provided this training were trained yoga instructors to deliver pre-selected yoga practices and health education. And the components of yoga comprise of 3 health rejuvenating exercises, 15 different postures. I'm not going to get into the details because it will take away a lot of time. But what we did was that we created a heart healthy package. Like, for example, we did not have exercises that would increase the stress on the heart. 5 breathing techniques and 5 meditative techniques were included. The control group received enhanced standard care that included 3 session educational information before discharge from the hospital, and subsequently at weeks 5 and 12, printed leaflet and delivered. This was delivered by a nurse or another member of the cardiac care team, either individually or in groups to avoid contamination. This is how the study was conducted. I will not get into the details. As you can see, it was very complex. We approached nearly 6,700 people. We excluded nearly 2,700 because they were not, either they were not willing to participate or they were not meeting the inclusion criteria. We randomized 4,010 patients, and due to a variety of reasons, we ended up with 3,959 patients. And so you can see it was almost equally distributed. In the yoga care, we had 1,970 patients, and in the enhanced standard care, we had 1,989 patients. Now, in terms of the baseline characters, when we randomize patients, they should not differ. They should be very, very similar for a variety of variables that included age, gender, the type of heart attack, the location of the heart attack, whether they had past history of pulmonary artery disease, whether they had concomitant diabetes, hypertension, tobacco use. Everything was similar between the 2 groups. Similarly, we looked at the drugs that were used and the treatments that were provided. They were exactly similar between the 2 groups. So this just shows that the baseline, there were no differences between the 2 groups. So after a 30-month median follow-up, we noticed that there were numerically fewer outcomes. There was a 9% reduction in what we call as MACE, major adverse cardiovascular event, that comprises of death, non-fatal myocardial infarction, non-fatal stroke, and emergency cardiovascular hospitalizations in the yoga care group, but this was not statistically significant. So what we are doing now is we are following these patients up so that we get 2 additional years of follow-up. The reason why this happened was our initial estimation was that we will have around 20% event rate in this 30-month period, but unfortunately we had just around 7.3% event rate. So we are looking at more events, and these results will come next year. So this is what is called as a Kaplan-Meier plot. For people who do not understand, it's just a very simple way of representing what is the survival of people who are in the yoga group as compared to the control group. So you can see more people in the enhanced standard care had events as compared to people in the yoga care group. This is the people who actually practice yoga at home and people who came for follow-up. That is, we call them completers, those who participated in more than 10 yoga care sessions. Recall that you had 13 yoga care sessions, the median was 10, and if people participated more than 10, they were called completers. And in people who completed the yoga care session, we observed almost a 46% reduction in composite events. But this kind of analysis, people would say, is biased because the randomization sequence is broken, but it just gives you an a window into the feeling that if people actually practice what you taught them, there would be greater benefits. The next is we looked at the second co-primary outcome because we wanted changes in quality of life. Here we had a clear-cut demonstration of improvement in quality of life. So we had what is called as a self-rated quality of life. This was significantly greater in the yoga care. The third outcome which we looked at was how frequently people return to pre-infarct daily activities. Nearly 17% of people who are in the yoga group, the people in the yoga care group had a 70% higher chance of going back to their pre-infarct activities as compared to people in the control group. And there were many other minor beneficial effects. So we concluded that yoga care, which is a yoga-based cardiac rehabilitation, is safe, feasible, and significantly improves quality of life and return to pre-infarct daily activities. The clinical outcomes were not different between the two groups. The reason was because, as I mentioned earlier, there was inadequate power to detect the planned difference due to the lower event rate than estimated. People who followed our advice to the T had better benefits, such that the pre-protocol analysis showed yoga care program to be efficacious in improving clinical outcomes, suggesting a potential dose-response relationship. So yoga care has the potential to be an alternative to the conventional cardiac rehabilitation programs and address the unmet needs of the cardiac rehabilitation for patients in low and middle income countries. The reason why this could be an alternate is we should understand that cardiac rehabilitation programs are extremely expensive. You require doctors, you require nurses, you require a whole host of people, a large area, and you require a lot of equipments. Here, we require a yoga instructor and a yoga mat. So that's the benefit, and so it has the potential to make cardiac rehabilitation inexpensive. I'm very, very grateful to many of these people who participated in the study. As you can see, Professor Manchanda was one of the important contributors to the study. I'm grateful to the trial participants and families. And these are pictures from the late-breaking clinical trial at the AHA. This is a very prestigious presentation. In that year, nearly around 2,000 to 3,000 people attended this program. At the beginning of the program, I asked a question as to how many people would believe that yoga will be helpful. Only around 18% of the people said that they believe that yoga will be helpful and would be like a cardiac rehabilitation program. At the end of my talk, nearly 67% agreed that yoga care would be a useful method to improve quality of life as well as improve survival. So this paper was published in the American Journal of American College of Cardiology. Dr. Valentin Fuster, who is the editor of Journal of American College of Cardiology, in this podcast. Actually, the link is here. You can listen to it. He says this study is not only relevant to India, but to the US, and he advocated yoga for survivors after a heart attack. So the last question that I want to ask is where to from here? So we are extending yoga care to several other conditions like heart failure, post-cardiac surgery, pulmonary hypertension, and several others. The reason why I'm talking about heart failure, because heart failure is going to be the next epidemic after we have actually reduced cardiovascular diseases. We have an aging population, we have a high burden of hypertension and diabetes, and therefore heart failure is going to hit us like a tsunami in the next 10 to 15 years, and we need preventive practices. So it has been shown that there's 11% reduction in all-cause mortality, 39% reduction in all-cause hospitalization, and 7-unit improvement in quality of life from cardiac rehabilitation programs. But these were from several small studies and is relatively smaller number of patients. But there are no studies on yoga as well as no studies from India on cardiac rehabilitation. We have been funded by the ICMR to conduct a randomized controlled trial of 3,650 patients, and this study will begin. It started because of the pandemic. Once the pandemic abates or we are able to recruit, we'll start doing the study. And we'll also conduct one of the largest mechanistic studies on heart failure. So this is based on a systematic and potentially low-cost cardiac rehabilitation model suitable for India and other countries. So what we are trying to generate is evidence on the effect of yoga-based cardiac rehabilitation in patients with heart failure using clinical endpoints such as all-cause mortality and all-cause hospitalization, patient-reported outcomes such as disease-specific quality of life, and mechanistic pathways through which the yoga intervention potentially exerts its benefits. So if I have to conclude, yoga has huge potential in cardiovascular care, but how the biggest challenge is in its scalability, sustainability, and acceptability amongst physicians and cardiologists. But I think using randomized controlled trials, if we can demonstrate benefits, and using implementation science and integrated care, we can actually scale this up. As the Persian philosopher of the 10th century said, there are no incurable diseases, it's only a lack of faith. Thank you for listening to my talk.
Thank you very much, Professor Prabhakaran, for your absolutely marvelous presentation on the rehabilitation of patients after the myocardial infarction. This is one area where the best of the minds fail how to rehabilitate them. And as you rightly said, that the rehabilitation care is so expensive, especially in the West, and so prohibitively expensive in India also, because only very few centers are giving rehabilitation programs to the patients in corporate sector. There are hardly any in the government sectors. So I think you make a very strong case by at least 2 points. One, that after the end of your talk, 67% doctors first said that yes, yoga and meditation can make a difference. So you have a very strong p-value there. And secondly, the quality of life that you showed has improved tremendously, has a very strong p-value. Now, the last speaker of the day is Dr. Indranil Basure, who is also the founding chairman of the American Academy of Yoga and Meditation. Dr. Basure shall enlighten us with his vast experience both as a yogi and cardiologist specialist on the intricacies of the mechanics of cardiovascular diseases. He is currently serving as the staff cardiologist and electrophysiologist, and also as the director of cardiovascular research at the Memphis Veterans Medical Center in Memphis. In addition, he holds an honorary adjunct professorship of the integrated medicine at the AIIMS Rishikesh in India. Dr. Basure has been meditating since the age of 6. He is a learned Kriya Yoga from multiple Himalayan gurus. He's also trained in Vipassana. I am also trained in Vipassana as well. So there we meet. Dr. Basure, please, for your presentation. You're mute. You are muted, sir.
Yeah. Thank you very much, Dr. Gupta, for the rather generous introduction and for having me. Let me share my slides. I think I'll have to open it. Okay. Entire screen. Can you guys, can everybody see it? Hello.
Yes, yes, we can see you.
So I think it's both Dr. Manchanda and Dr. Dorairaj really showed how effective yoga is. So my job becomes a little more difficult, or maybe a little more easy, because my job today is to show the science behind this. Everything that Dr. Manchanda said, Dr. Prabhakar said, for 10,000 years, we did not know the science. But luckily, in the last 10 to 15 years, there's been a bunch of research using latest techniques to find out if really yoga works. And there is tremendous amount of accumulated evidence, as one of them, Dr. Manchanda showed, the American Health Association guidelines on use of meditation. Like that, there has been tons of research, and almost in the last 20 years, there's almost 3 Nobel Prizes, which sort of supports some aspects of the entire philosophy of yoga. So let's delve into some of these. I'll try to be quick and give an overview without going very much deep, because a large ground needs to be covered. So obviously, yoga is an ancient Indian technique of healthy living. I'll not go more deeper. You have heard a lot of it about from Dr. Manchanda. So extensive research in the last few decades have revealed the critical role that yoga can play in eradicating stress. And stress is one of the root causes for whether it is heart attack, whether it is different types of tachycardia, arrhythmia, or the largest cause of death, which is sudden cardiac death. Every 2 minutes, somebody in America, for example, dies because their heart suddenly goes fast and they die even before calling an ambulance or a helicopter to come and pick them up from their home. So numerous studies have corroborated yoga's beneficial effect on autonomic function and negative emotions. This has led to the foundation of a scientific understanding, starting from mechanics at the level of endocrinology, at the level of genetics, at the level of epigenetics. We'll go through some of them quickly. So through my talk, we'll talk about the brain autonomic nervous system. We'll talk about the psychological mechanism by which yoga helps, the endocrinal mechanism, the cellular mechanism, and then a quick wrap up of the genetic and the epigenetic mechanism that yoga induces, that brings a rapid reduction of not only the risk factors, but also helping repair and cure people who have already had a heart attack, peripheral artery disease, or a stroke. So the biggest number of changes are in the brain. So what has happened is that in the last 2 decades, with the use of functional MRIs, which is computed tomography with radioactive targeting, we are able to reach deep inside the brain, which was completely inaccessible for a human being, because in a living human brain, you cannot put in electrodes, you cannot make holes to get inside like they try to do in animal. But an animal brain is an animal brain. The largest animal brain is only 800 cc of a large adult gorilla, whereas our brain at least is 1600 cc or even more. So animal studies unfortunately do not replicate, and things like yoga and meditation requires higher level of consciousness, which lower animal may or may not have. Therefore, unfortunately, animals are not the best experimental model for the changes that we see in human beings. But thankfully, in the last 20 years, due to this latest technology, we have been able to go deep inside the brain and find out what is happening. So the first and foremost, the most surprising thing is yoga makes your brain grow. As all of you know, after 25 to 30 years of age, your brain stops growing, and every day you lose 300 to 400 brain cells. And that's why in most of the Western countries, after 80, 85, almost 35% of the population languish in old people home or nursing homes with severe memory loss. They don't know who they are. They don't know who their family is, because their brain, which is a large full brain when they were 10 years, 20 years, 30 years, 40 years, becomes even smaller than a monkey's brain by the time they are 85, 90 years of age. But this is the first time that human beings got to see that yoga actually makes your brain grow. After the initial paper by Sarah Laser at the Harvard Medical School, there have been over 86 papers that show the growth of brain in different areas. It's just not a question of growth. There's also the question of decreased growth. And that's very interesting. Why does the growth decreases? There's a decrease in growth of areas called the amygdala hypothalamus, which deal with negative emotion. So if you're a person who's always depressed, always anxious, you have had history of abuse all your life, you are supposed to have a large amygdala and a hypothalamus with superactive negative emotions. But as you practice yoga, it is clearly seen where the good areas increase in size, the bad areas, their size and their function decreases. There's also change in the brain neurochemistry from having depressive chemistry like dopamine. You tend to have chemical changes that has things like serotonin, which makes you feel happy, makes you feel elated. And that's why, remember, in the yoga literature, we don't even have the term happiness. We have a term called bliss, ananda or bliss. And there has been a discrete change in discrete changes have been found by using microelectrode microdialysis of the amount of serotonin found in the patient, found in people who have been meditators for 15 or 20 years. The other important thing is, as I said before, the different basal areas associated with negative emotion and stress, like the hypothalamic pituitary axis, they are decreased in their functioning as well as in their in their anatomic size. In a study that was done in Hungary, where they took around 60 young people who were in foster homes, and they had a long history of childhood abuse, then they had huge amygdala. When they were taught meditation, it was found over a span of 1 to 2 years, not only their amygdala size normalized, their abnormal behavior pattern also changed. So let's move to the next thing, and that is what does yoga do to EEG recording? As you know, brain is electromechanical organ. So the electricity is generated, electrochemical organ. Electricity is generated by the brain cells, and there is chemistry is used. Multiple chemicals are used also to generate polarity and electricity. So if you see a normal brain, you'll find there are massive fast waves called the beta waves. So brain is a paradoxical organ. The faster the waves, less active your brain is. People who are in deep concentration, they tend to have slow waves called the alpha waves. Say, for example, I'm talking to you, so I need to see what I'm doing. So there are two areas in my brain called area 18, 19 behind my back of my head. If I put a microelectrode there, I'll find while rest of my brain might have beta waves, fast wave, those areas will have slower waves called alpha waves, which makes me concentrate. So when the brain is active, it will have slower waves. And the strange thing is that people who have been meditating for 20, 25 years, they have extremely slow waves like theta waves, delta waves, and some of them who are in, some of them might even have what is called the gamma waves. There's some thought process now in the frontiers of medicine that gamma waves may be the sort of waves that mediate consciousness. But anyway, that's a Nobel Prize topic. Let's not go into that. But long story short, your entire brain from a non-functioning but so-called paradoxically active organ becomes a functioning organ when you practice meditation for a long time. The next important thing is what we call as neuroplasticity, or the growth of your brain. Your brain stops growing other than a few very small places in a normal human being. But when you practice yoga and meditation for a long time, the signaling pathway that causes brain growth, that tremendously increases by multiple factors. So the scientific name for that is called mTOR. So the mTOR signaling is accentuated. So you have large areas of brain that is actively growing. New brain cells are not only created, new sequence of brain activation is created. For example, suppose I'm a person who's always anxious, who's always depressed. When I practice meditation, those depressive, those anxious neuronal circuit are replaced by circuits which would make me less anxious, to complete loss of anxiousness and make me less stressed. And that's very important because this happens because there's an entire change in chemistry at the molecular and genetic level also inside the brain, including the genetics of the individual neurons. There are different pathways for it. There are some pathway called the sirtuin pathway. I'll not go into the detail, but what this pathway does, it actually grows the food for the development of the brain. So brain needs something called the brain derived nootropic factor that nourishes the neurons, nourishes the blood brain cells and make them grow. And that is increased multiple times through these pathways. And these pathways are increased in multiple magnitude in people who are meditators. In fact, some of the meditators, Hindu and Buddhist monks, have been seen to have blood levels through microdialysis inside their brain neurons or in the brain fluid called the CSF, multiple magnitude more than common person who never practiced or has never tried out meditation. The autonomic nervous system and its role in meditation is pretty well known. I don't want to spend a lot of time for saving time, but basically what it does is we have something called the flight or fight mechanism. Why? That's because in this 2 million years that we were on earth, unfortunately, we don't get up in the morning as we do now, have a cup of coffee, meet with the husband or the wife, or talk to your dad, or talk to your mom, or talk to your kids, buy them to the school. That unfortunately did not happen other than maybe the last 3 to 4,000 years. For a million years that we existed on Earth, when we got up in the morning, the first thing we might have seen is a large anaconda trying to slide into the cave, or a saber-toothed tiger just standing outside the cave willing to greet you. So you had two options. You'd either kill them or run away from them. And thankfully, our predecessors did the right thing, and that's why you and I exist today on Earth. So this is called the flight and fight response, and this response is mediated by the sympathetic nerve. Unfortunately for us today, despite the fact there's no saber-toothed tigers or dinosaurs roaming around, but our behavior pattern is the same as that. Because suppose I am just angry at you for a very simple menial reason, or I'm just jealous of you for no damn reason. But what happens to me is that I still have this flight or fight response inside me, sometimes consciously, sometimes unconsciously. So they generate all the bad chemicals inside my brain, making my brain to be having stress, depression, anxiety, and a lot of stress actually kills brain cells. Similarly, it causes release of a bunch of chemical inside my heart that may make my heart go fast. And as I said, one of the commonest cause of death is sudden cardiac death. Almost 47% of deaths due to heart disease can be due to that. And you can have sudden cardiac death because of the chemical that is being released because of your brain being agitated. Your heart goes fast. You can have heart attacks. You can have stroke. You can have peripheral artery disease because there's inflammation in all the blood vessels, as we are going to talk shortly. So it's very important to understand that yoga has this beneficial effect by accentuating the work of the parasympathetic and dousing off or shutting down the fire of the sympathetic. The breathing technique called pranayam, which most of you guys must have heard as part of yoga, plays a big role in many diseases. There have been tons of paper on atrial fibrillation, on people getting ICD shocks, as Dr. Dorairaj pointed out, in rehabilitation. In rehabilitation, it's the same problem. There is a sympathetic overdrive because you just had a heart attack, and a large part of your heart cell may have been damaged, or a large part may have been saved by an angioplasty. But remember, angioplasty doesn't change. Angioplasty opens up the arteries but doesn't change the basic disease pattern. As long as your brain is stressed, you continue to elaborate those chemicals which continue to be damaging, which unfortunately modern rehab mechanisms have never looked into until last 10, 15 years, when slowly we are understanding the role of stress, role of the brain in heart diseases. So the other important thing is that the yoga reduces the wear and tear of the body produced by chronic stress and by lessening sympathetic overactivity and also by improving parasympathetic tone. I don't want to go into the details now, but we'll talk about some of the things. The other next important thing is the psychological effect, so when you start doing yoga, as I said, you tend alpha waves in your brain or even deeper waves. People having 10 to 15 years of yoga meditation practice can have even delta waves. So those get rid of anxiety, those get rid of depression, despair, anger. And it's particularly so because of things like pandemic, which is occurring now. Thousands of people have been rendered jobless. People are sitting at their homes in loneliness. All this initiate a lot of stress and despair, which can be appropriately attenuated using yoga. About the endocrine effects, I'll not go into deep, but just a couple of things. As Dr. Manchanda said, that stress causes production of a lot of glucocorticoids because that is part of the flight and fight mechanism. Glucocorticoid, unfortunately, is friendly only in a very small number of cases. It's unfriendly in most of the cases. Why is it unfriendly? It's unfriendly because it increases atherosclerosis. It causes blockage of your arteries, leading to stroke, leading to heart attack, leading to peripheral artery disease. It decreases your chance of fighting infection. So when you're depressed, when you're anxious, when there's increased stress in the brain, not only increase glucocorticoids kill brain cells, but they also induce release of a bunch of chemicals inside the body that decreases your immunity, your chance of suppose you're attacked by a COVID virus, there are cells called the natural killer cells which eat up this virus. But the natural killer cell function is reduced almost 100 to 150 times when you have a large amount of glucocorticoid in your blood. So what we know now is practice of meditation decreases that by different ways. Number one, the hypothalamus, which actually releases the precursor of ACTH from where the corticoids come, called the corticotropin releasing hormone, that is decreased. In fact, the whole genetic sequence of release of CRP or corticotropin is decreased so that it produces less corticotropin, so that there'll be less release of ACTH by the brain, and thus less corticosteroids are produced. Not only that, there are other mechanisms too. The number of receptors peripherally for corticosteroids are decreased also. So though you may be stressed out and you have a bunch of corticosteroid floating in your blood, they are ineffective, and thus they cannot produce decreased immunity or your chance of fighting a COVID infection or your chance of developing a heart attack or stroke, because they don't have receptors through which they need to act. So these are some of the mechanisms by which it does. And yes, a lot of immunological changes is brought about by yoga. One of them is it activates a lot of cells called the CD3, CD4, which helps us fighting cancer, fighting viral diseases. It also increases something called IgA or immunoglobulin A. As you all know, with this pandemic, the fear is that if you have a COVID virus entering you, the COVID virus can be killed even before it actually enters your body because of IgA, which lines our lungs, our GI tract. But this IgA level is increased multiple times in people who practice yoga. Just 4 to 6 weeks of yoga practice can increase your IgA level by 1.5 times. So your chance of getting COVID out of your body is way increased when you practice yoga. So this is a study on cancer patients, which actually showed that cancer, just like COVID, produces a lot of negative inflammatory markers. So these are chemicals in the body that cause inflammation. And as you know, inflammation leads to heart attack, heart failure, stroke, peripheral artery disease, a bunch of arrhythmias, all of which can actually kill. And all these together actually result in the number of deaths we have. Even people with COVID, as you know, very mild COVID can have prolonged cardiac problems because some of the worst players are increased in COVID, called like interleukin-6, tumor necrosis factor A. Now, interleukin-6 is increased by almost 80 to 100 times in COVID. It can be increased 50 to 20 times in cancer patients. So this is a study on cancer patients where they showed that just 6 to 12 weeks of yoga practice actually brings down your interleukin-6 levels within 3 months. And the control were people who had normal normal modern cancer therapy. And the study was in one of the world's #1 cancer hospital, the MD Anderson, and they clearly showed that yoga plays a dominant role in bringing down interleukin 6. We can expect similar effect in other places. For example, in heart, post MI, also there's increase in interleukin 6. Anything where the body is stressed out, there is release of interleukin 6, and more than often, instead of a good role, it plays the villain's role, and yoga helps to attenuate that. Same may be the story with COVID also. Maybe people who have been practicing yoga for a long time may have lower release of interleukin 6, so their chance of developing moderate to severe infection in COVID may be decreased in the very initially because of a practice of yoga. Now, genetic effect, there's a lot of genetic effects. I don't want to go to the details, but a couple of them, as I said, it increases the level of the basic nutrient which feeds the brain cells and keeps brain cells alive, make them properly functioning, called as BDNF, brain-derived neurotropic factor. Just like you and I live because we have food. If I was made to starve, I'm going to die maybe after 15, 20 days. Similarly, if you take off BDNF, the neurons die. And this process of finishing off BDNF so that its activity is decreased is a process called methylation. So yoga has been shown to decrease methylation of BDNF. People practicing yoga have a much higher level of BDNF, so their brain is having a nutrition factor supporting brain growth much more than a person who has never practiced yoga. Meditation also plays a very important role in producing BDNF, but it also, as I said before, it decreases glucocorticoid receptors inside the brain. As I said, excess glucocorticoids can actually kill your brain cells because toxic stress that is toxic, that has remained for a long time, is actually killing to the neurons. It kills the neurons. It causes your heart to go fast and can also make you die by what is known as sudden cardiac death. A bunch of other things also happen. I'll not go into the details for this particular talk. One last but not the least is the role of telomerase. This is Elizabeth Blackburn. She got the Nobel Prize in 2009 to show that you actually decrease aging when you practice meditation and yoga. How do you decrease aging? You decrease aging because of something called telomerase, which helps to decrease aging. This is a study in patients with high blood pressure on multiple drugs. A part of them were taught yoga and meditation. A part of them were not. Those who had taught meditation, yoga, they had longer telomerase, so they lived longer. And because of this concept that has come from yoga literature, today in modern medicine, we have a concept of chronological aging and biological aging, where chronological aging means how long you lived on earth. So if you're 90 years old, you lived for 90 years. But the body mechanics of yours, because of practicing yoga for 10, 15 years, may be as young as a 60-year-old person. So technically, though you're 90 years of age, but your body is as fit, your brain is as fit, your muscles are as fit as a 60-year-old man. So you save 30 years of aging by just practice of meditation. Last but not the least, now we know there are over 330 genes which form called the CTRA. So CTRA is a bunch of genes that get activated when human beings are faced with uncertain times like this pandemic. So when you have loss of job, when you have a close person dying because of COVID or whatever reason, when you're lonely, these gets activated and they cause widespread inflammation leading to severe heart attack, heart disease, uncontrolled diabetes, stroke. Some people even believe cancer, though there is some controversy. But though we do not know if toxic stress can actually cause cancer, there is 100% proof that toxic stress can actually help to make your cancer progress faster if you already have a cancer. So it helps in metastasis, that is spreading of cancer. So the CTRA is effectively stopped by practice of yoga and meditation. I'll stop now. Thank you very much.
Thank you very much, Chairman Sir, for your beautiful presentation and covering a very complex mechanism of cardiovascular diseases and the impact of yoga and meditation over them in a very simple manner for the viewers. I remember recently what you said, autonomic surge can cause cardiac arrest. A footballer named Eriksson had a cardiac arrest on the field. He was resuscitated and was found to have an absolutely normal heart. So I'm sure that he must have had that autonomic surge. I have several questions now from myself as a moderator, but for the paucity of time, I will take questions first from the viewers who have sent us. The first question is, how can yoga help in case there is a strong family history of cardiac issues? I think Dr. Manchanda maybe may like to answer this question.
Yeah. Well, we know that heart disease can occur in families and all. There are some genes responsible. They are being identified. But as you heard from Dr. Basure, that gene expression can be suppressed by yoga. There's several studies which have shown that even if you have the genes, they will not express. It is the epigenetics which is important as far as causation of heart disease is concerned, not the genes. I don't think our genes have changed in the last 50 years. We have the same genes as our parents had, but the heart disease is increasing rapidly. It is the gene expression. And yoga has the potentiality to decrease the gene expression. So even if we have the genes, I think it can be suppressed. But following a yoga lifestyle will help to prevent the disease anyhow.
Thank you, sir. I'm sure that your answer must have satisfied the viewer. The next question is, if a person has too high glyceride level and if their artery is already blocked, is it possible to prevent a heart attack with yoga and meditation before it is too late? I think Dr. Basure may like to answer this question. This is something to do with mechanics.
Yeah, so it is important to understand that most of what we call the heart attacks are basically in simple language of three types. One we call STEMI, one we call non-STEMI, and I don't want to go to technical, and the third is unstable angina. Most of the reason you have STEMI is not because of blockage of the blood vessel, because in STEMI, in majority of the cases, actually your blood vessel is quite open, but this called the rupture of the plaque, which means that there's inflammatory bulk inside your blood vessel, but that inflammatory bulk is not big enough to completely close your blood vessel. There's enough blood flow, but suddenly due to sudden events, for example, stress, they just rupture. And the moment they rupture, what happens is they invite a lot of other blood vessels, platelets, and other things, which forms a solid blockage, and that's how your blood cell gets blocked. The tube that carries blood gets blocked, and you have a heart attack. So obviously, the mechanical block that the questioner is talking about occurs in actually a minority of patients. In majority of patients in STEMI, some people say it's 70%, some people say even 90%. It's not because mechanically your blood vessel is blocked. Blood vessel gets blocked mechanically. Secondarily, the primary problem is inflammation. And that inflammation can appropriately stop, as Dr. Manchanda said, by regular practice of meditation and yoga. And earlier you start, the better. Now, talking of the minority who have already blockages, that is like, say, 90%, 95%, for them, it is absolutely important that, yes, you need to be on medications. And if you have pain, you might need to even have an angioplasty. But remember, angioplasty temporarily opens up that blood vessel. Or if you have bypass surgery, that bypass surgery will temporarily open up their blood vessel. So your disease is not actually treated. What they are doing is they are preventing your heart cell to die further by opening up those blood vessels. So if I have to give you an example, if your roof is broken and you start leaking during monsoon, it is raining in India now, you start leaking, you cannot put a bamboo stick on one side of the roof and say, my roof is repaired now, because the bamboo will prevent the roof from falling down, but it doesn't treat it. You got to make a new roof. So you have to understand that these processes are not stopped by bypass surgery or angioplasty. They are like putting a bamboo stake so that you don't have more damages. Now it's your chance to start a yogic lifestyle so that in the next 3 years, next 10 years, next 15 years, you don't have to go for second, third, and fourth stent or second, third, and fourth bypass surgery. Because remember, every time you go for a bypass surgery, a chance of death increases. So the treatment for bypass surgery and angioplasty, modern medicine is extremely good, but they're highly restricted to what they can achieve. They can save you from dying immediately, But if you want a life without any more problems, you have to go for a long-term practice, like practice of yoga and meditation, as Dr. Manchanda pointed out. And moreover, again, as Dr. Dorairaj pointed out, it is not surprising that you have to kill that sympathetic drive in you. If you have to have a standard rehab, followed by most Western countries does not help to do that. So that's where yoga also plays an important role. I hope I have answered both part of the question.
Yes, sir. Thank you very much. I think viewer was actually in your mind. He was reading your mind, so he asked a follow-up question already. How soon after the surgery we can go for yoga? I think Dr. Dorai Raj could be more
Right.
useful in this. Thank you.
So actually, if you're talking about cardiac surgery, in fact,
I'm sure that is the cardiac surgery, I think.
yoga can be started even within the hospital stay, because the breathing exercises, gentle breathing exercises, gentle pranayama can be started so that the lung capacity improves. And in fact, the physiotherapists in post-cardiac surgery provide that kind of a training. Subsequent to that, meditation and other things can be started at the time of discharge. And within a month, a full complement of yoga practices that we use for cardiac rehabilitation can be started. Of course, we should avoid postures like Shirshasana or Kapalbhati, which can cause Valsalva maneuver and can cause problems. But other than that, many of the yogas are quite safe, and one can do that.
Thank you very much, sir.
Can I add up a little bit?
Sure, sir. Sure.
Yes, Dr. Bhakar, sir, I agree. You see, it can be started before surgery. And there are studies now available, including All India Institute. Dr. Usha Karan, she used to teach meditation before they went to surgery, and their stay in the ICU is much less. But as he said, you can start it immediately, meditation, etc. Only stretching exercises after 3 months. And there are 2 studies of cardiac rehabilitation, which I was telling after bypass surgery. And the largest is from Bangalore, and they have clearly shown that these patients benefit. But of course, you have to avoid the stretching exercises because the wound takes 3 months to heal. You can start meditation and yoga, but it's extremely useful because depression after bypass surgery is very, very common. That increases mortality, and therefore I think it should be done. And there are studies available to show that this is very beneficial.
Thank you very much, sir. I also advise my patient to do gentle pranayama before surgery when they are in hospital waiting for their surgery, and following surgery also they do pranayama, and that helps them a lot. There's another question that what are the effect of food habits on the lifestyle in cardiac patients? It's a very simple question, but I think this is one very brief answer from yes, sir.
Very in a very simple way. I think it's diet is very important. One advice I give to my patients as to anybody who asks about diet: don't focus on single foods. You focus on your dietary patterns. So most important thing is to reduce the portion size. You eat whatever you want, but reduce the portion size. Second is have a good mix of have a diversity in your diet. Make it more colorful. When you have color in your diet, that means you have pectins, you have different kinds of fruits, you have a lot of antioxidants in your diet. And obviously these are expensive, but please go for locally available, inexpensive, seasonal fruits and vegetables. Replace one serving of rice or chapati by one serving of vegetable and one serving of fruit, whatever that is available. If you decide to eat more, exercise a little bit, and then you take it off. So Dr. Manchanda can add to that.
I just like to add up. You see, I think diet is very, very important, as he said. You see, it is said in Hindi that "Jaisa an vaisa man." As you eat, so your mind will be. You have to have happiness foods also. And he said it is the fruits and vegetables which are very, very important, and nuts, which have been shown to even decrease inflammation in the brain, etc., and the body also. Secondly, we ask them only to avoid refined foods. Only 4 refined things, like sugar, for example, sugary drinks, etc., and the white bread or the maida, we call it. And the third thing is the white rice, and the fourth thing is refined oil. These 4 things should be avoided. Lots of fruits and vegetables, a lot of data that as you eat, so will be your mind. As your mind, so will be your thoughts, and so will be your health. So it's very, very important that we have to take a lot of data is there on vegetarian. I do believe in vegetarian food because it has several advantages over the non-vegetarian. It's not a single disease which has been shown to be caused by vegetarian. On the other hand, non-vegetarian food has been shown to cause a lot of problems. So I believe in vegetarian food with lots of fruits, vegetables, and avoidance of so-called the refined and the processed foods.
No, I just
Thank
want
you
to
very
add
much.
one sentence.
Yeah.
Moderation, not martyrdom, should be our goal. So we should be moderating whatever we do. And the second thing is there is a Tamil saying which says Amrit, which is the nectar of life. Even Amrit, if taken in excess, can become poisonous. So I think we should bear these two things in mind. Just be moderate in whatever we do.
Thank you very much. I think we are up with the time. I think we can conclude from this very high-powered scientific investigations published in the peer-reviewed journals, undisputedly, that has set the level A evidence for yoga in heart diseases. Exactly the same idea was documented in the first mantra of the 81st Sukta of 5th Mandala of Rigveda, Yujjate man ut yujjate dhiyo vipra viprasya varhato vipashyate. So, for all the benefit of the humankind nearly 8,000 years ago, now well established using optical simulated luminescence by the ASI Archaeology, Deccan College of Pune, and IIT Kharagpur. I thank all the wonderful speakers who had given their precious time to enlighten us on this subject. Thank you very much. I hand over to the hosts. Akash.
Thank you so much, Doctor. Thank you so much, Doctor. Wow, that was such an informative webinar. I mean, we saw from Dr. Manchanda's presentation how relevant this topic is to the world. Cardiovascular diseases are the single biggest death factor in the world, accounting for almost 31% of all the deaths by diseases. Many people think that cardiovascular diseases are only caused by physical factors in the Annamaya kosha, such as diet, smoking, lack of exercise, etc. But Dr. Manchanda, you spoke about emotional factors such as control of anger, ego, jealousy, and hostility. So interesting to know that the emotional component is just as important, if not more, than the physical component. Dr. Prabhakaran, I loved how you showed how each limb of Patanjali's Ashtanga Yoga plays into caring for patients for cardiac rehabilitation. You also showed us some great research meta-analysis that proves the wonderful benefits that yoga has and how it helps patients with these illnesses. Like you said, very few people know the full benefits of yoga. Only 18% said yes when you asked them. That's why your presentation was so effective. You summarized the successful findings of your research very well. Dr. Basire, you showed us the true science behind how yoga and meditation can help in all matters. Contrary to intuitive reasoning, you showed that meditation causes slower waves, like theta or delta waves, as the yogi concentrates on his meditation. You also showed us that meditation increases blood flow to the brain to extraordinary levels, and it also increases oxygen levels in the body, which has many benefits in different areas of life. Dr. Gupta, that was really great moderating. You perfectly tied the topics of each of our speakers, and you were able to get most of the questions done in this very short time. You did it very efficiently. Now, I would like to thank all of our guests, Dr. Manchanda, Dr. Prabhakaran, Dr. Basire, and Dr. Gupta, for enlightening us with your immense knowledge. I also would like to thank our tech team, Sagarji and Anjaliji, without whom this webinar would have been impossible. Our next event for our viewers is a session on corporate yoga, corporate responsibility and yoga, and it will be starting in about 10 to 15 minutes. Please visit the AAYM website for more details. Thank you so much for attending this webinar. Good morning, good afternoon,
Thank you.
and good night to all of our viewers all around the world. See you all
Thank you.
very soon. Namaste.
Goodbye. Goodbye.
Thank you.